Welcome, guys, to your lecture on Individual Module 1, Family and Health, Wellness, and Illness. In this lecture, we're going to talk about family health and wellness promotion, family responses to health promotion, and theoretical models used in designing health promotion programs. So, for this lecture, in these modules, here are your learning outcomes, and these should be the same that are in your syllabus and the same ones from your book. First of all, let's talk about family assessment. And before we can assess a family, we have to know what a family is. What is it comprised of, right? So the definition of a family is two or more people that are joined by blood, marriage, or adoption and reside in the same home or household. That is the definition that the U.S. Bureau of Census uses for family, but we know that family is much more than that. There is really a much more broad definition that encompasses what people believe family is. Um, you can consider people your family members who you have an emotional closeness to. People can become honorary members of your family. They can be people who are support persons for you. So a family can consist of innumerable um, different scenarios, and it all depends on really how you grew up and how you view things. There is no typical family. So when we start talking about family structure and we talk about membership and the relationship of members to each other, we have to keep in mind that we may be talking about with our patients more than what is our cultural norm for what we believe family is. So we really have to get to the bottom of what did they feel like family is. Families function in different ways and in different roles. There are different function and roles within the family structure itself, and there are different function and roles outside of the family in society. Family function and roles provide lots of different things. They provide interdependence, and this just means that there's an influence on each other whenever you start to talk about and think about different function and roles that each family member plays. They become interdependent on each other and they influence the way other people within that structure react to different situations within the family and outside of the family. Um, Function and roles also provide maintenance of boundaries. Each family has a distinct culture, all on its own. And from that culture, from within inside the family, comes values and what people, how people learn to live their lives. And those are transferred out into society. Function and roles also provide an adaptation to change. It creates a progression of members and their roles within the family. And the function and roles also will provide performance of family tasks. So these performance of family tasks will help maintain the stability of that family. For things even as simple as who cleans up, right? Who keeps the house clean? Who washes the dishes? Who does the laundry? Who mows the yard? Um, Whenever you establish function and roles in a family, everybody kind of gets their own little niche. And if you think about your family, you can probably sort of start to figure out uh, exactly what your function or your role is in regards to your family structure. So really, why do we care about all of this? Well, as nurses, we care about this because we want to provide family-centered care. That's really what we talk about in this course is taking care of the family. And family-centered care means developing an effective partnership with patients and their families so that we can meet their healthcare needs and improve their outcomes. And all of that becomes what we term family-centered nursing. So along with trying to improve healthcare needs and improve outcomes, we have to think about health promotion. And the World Health Organization defines health promotion as a process of enabling people to increase control over and improve their health. Health promotion enables individuals to do exactly what we just said the definition is: assert control over their health, improve their health, and that includes things from physical, mental, and their social well-being. And we can even throw spiritual in there. It also enables individuals to be able to access a community base of care. It involves clients' environments, right? So think about the health department and all of the different roles that the health department plays in the community, like vaccinating children. That helps improve client environments for the community as a whole, really. But health promotion can be very challenging because it's sometimes very difficult to change people's ways. It's difficult to change their cultural norms. It's difficult to change their values in the way that they think about things. So, for example, a smoker values their cigarettes. It's very difficult to get them to um, promote their health by quitting smoking. It takes a lot of work to do that, especially as a nurse when you're only seeing them for short periods of time. Um, so what about wellness promotion? Well, wellness requires people to be self-responsible. It requires them to have an ultimate goal. Wellness is a dynamic process. It's constantly changing. It's a growing process. There is daily decision making that has to go into maintaining a state of wellness. So there are outward manifestations of wellness, and wellness is also a state of mind. It's how well do you think you are. The National Wellness Institute states that wellness is an active process. So exactly what I just said. It's a dynamic, growing process. It's always evolving. It includes mental and spiritual well-being, um, which all of us, especially those of us in nursing school, knows is definitely an active process, right? You get really stressed out before you start to take a test. After your test is over, then you can kind of relax your mental state a little bit till you can amp up for the next one. And we also know that spiritual well-being is also a continual process for a lot of people. Um, Lifestyle and environmental factors also contribute here. With wellness promotion, we have to think of 6 interconnected dimensions or concepts. So the 6 of them are the physical, the emotional, the spiritual, intellectual, social, and environmental. And your book adds in a 7th one, which is occupational. So whenever we think about these 6 dimensions, we have to consider how all of these things fit together to help promote someone being well. If they're physically in good shape, Are they emotionally in good shape? Do they have a good spiritual background, and do they feel at peace where they are spiritually? Intellectually, are they competent? Um, Socially, are they accepted? Environmentally, or do they live in a safe place? And occupationally, are they safe at their workplace? So all of these things can contribute to a state of wellness. And back to the family, whenever we talk about wellness promotion, we have to consider wellness in terms of the family unit and not just from an individual perspective. Um, for example, if you're caring for a child that is overweight, well, children don't buy the food in their home, the adults do. So we have to think of things from a family unit perspective and gear our education and our nursing process towards that family unit. And to be able to understand that family unit, we have to have a good assessment and a good idea of what encompasses that unit as a whole. We need to empower our clients to make beneficial changes. So if we see a child in the pediatric clinic who is severely overweight, we need to help that mom make some beneficial changes to promote wellness for that child. So maybe we can help her out with a diet plan or a nutritional habit changes, instruct her how to read food labels, teach her how to shop the grocery store on the outside, teach her how to put together healthy snacks that her kids will like and eat, help her navigate how to, I guess, get her kid to eat those things that aren't chips and soda, how to manage the behavior that she might get whenever she tries to change the nutritional status of things. There are lots of different things that we can do to help empower clients to make beneficial changes, but we have to understand their needs. We have to understand the wants of the client and the family itself. Family development refers to the different dynamics or changes that a family experiences over time. And there are lots of them. And if you can think back from how much your family changed from the time you were born to now, you can probably run through some of these developmental stages and tasks and realize sort of how far along your family came and how dynamic situations changed the different roles and functions for individuals within that family. There's a model on page 1712 in your book. It's table 26-1, and this is an 8-stage family cycle. I would review that if I were you, but also know that this model is based really only on the nuclear family. And as you learned in your first nursing course, there are many different types of families. The nuclear family probably these days is one of the most scarce you'll find. So keep in mind whenever you're reviewing and studying that chart that it's based only on the nuclear family. But let's run through it real quick. So once a family starts to develop, usually it starts out with a couple, right? These two people establish themselves as a couple. They establish themselves together as a family unit in the community. They might get married. They may live together. They establish a mutually satisfying relationship. They start to decide about children and if they're going to have any or not. And so this is kind of a first stage of development for families. This couple has to establish themselves together. They have to figure out who each other are. They have to be mutually satisfied together. to be able to progress on to this next stage successfully. When the next stage starts when they actually have children, right? They end up being a family with infants and preschoolers, and move to preschoolers. And so, what do they need at this point? Well, they have to adjust their supporting needs from just dealing with themselves to dealing with more than just themselves. They have people who depend on them now, little people. Um, they have to develop an attachment between themselves and the new little people that have come along. They also have to adjust to economic costs, and this can be really huge, big one, especially when you see these people in the healthcare setting. They have to cope with energy depletion. I stuck this little picture on this slide because for some reason this just reminds me of what my family looks like. I feel exactly like what that mom looks like most of the time. And I probably look like that most of the time too. You are exhausted whenever you have children, and um, it's a huge developmental stage and task to conquer and successfully meet. You have to cope with a lack of privacy. I cannot even go to the bathroom without somebody yelling, "Mama," or coming to find me. Um, it is quite ridiculous, and those of you who have children know what I'm talking about. We also have to help them carry out activities to enhance growth and development. So, as parents, you have to nurture your little children and you have to figure out how to do that, especially as new parents, because they don't come with a handbook. You have to figure out how to do that successfully. And sometimes that might mean finding them somewhere to go for preschool, or helping them with their homework, teaching them manners, teaching them how to eat at a restaurant in public. There are all kinds of different things that go into that. So let's move on to the next one. So now we got to progress through family development with school-age children. And what are the stages and tasks associated with that? Well, the family has to adjust to an expanded world of their children in school. And not only do they start school at this time, but they also start playing things like t-ball, soccer, dance, their karate. School-age children these days are now involved in so many activities. So we have to adjust to their expanded world. We have to encourage educational achievement. Whenever we send them to school, we have to encourage them to be successful, and we have to figure out how to do that homework in the afternoon. And it's very stressful on the family, especially if both parents work outside the home. We also have to promote joint decision making between children and parents. School-age children are starting to want to sort of develop their own identity, but they're not quite adolescents yet, so they're not pulling away from their parents, but they're just trying to sort of figure out where they fit in. What can they do? What can't they do? And they need their parents to help them make decisions, but parents also have to be able to let go a little bit to also give them autonomy to make some of those decisions for themselves, because it helps them with problem solving. I love this little picture on the slide that says, "When I grow up, I want to be like mom." And you can see all of these people, little stick figures, standing around with money in their hands, and you see the mom on what looks like a stage with her hands on what looks like a pole. So it appears as if she's a pole dancer. And you see the little note that this mom has written back to Mrs. Jones, the kid's teacher, that says she wants to clarify that she is not now, or has she never been, an exotic dancer, that she works at Home Depot, and she told her daughter how hectic it was last week before the blizzard hit, and how she was trying to sell the last shovel in the store. So this is like the story of my life. This is when your children become school age and they start to embarrass you about everywhere you go. So what about families who have adolescents and young adults? This is a really challenging time, especially with adolescents. You have to provide a supportive home base for these guys. You have to maintain open communication and you have to balance freedom with responsibility, right? So adolescents really are starting to find themselves. They are pulling away from their parents. They are developing their own identities. And they want to be independent so bad, but they really just can't get there yet. Now, young adults can because these people are starting to go to college. So it's a transitional time really for both children and parents. And then what about families with middle adults? Okay, so these are your older parents. Um, these would be like my parents. Um, They maintain ties with older and younger generations. They start to plan for retirement. They reestablish relationships and they acquire the role of grandparents. So when it says maintain ties with older and younger generations, this is sort of your sandwich generation. These are your families with parents who are caring for parents and caring still for young adults or middle adults. So this sect of individuals are starting to plan for retirement. They're saving their money. They're trying to save their time at work. They are, you know, trying to figure out are they going to move or not? Are they going to stay in the home that they're at? Are they going to retire in a different city? Are they moving closer to grandkids? But they're also having to reestablish their relationship with each other because at this point, their children have left home, they're developing families of their own, and so they're having to get to know each other again. And then they're having to learn that role of being a grandparent because their children are starting to have children. Um, this becomes a really difficult family stage whenever you have your middle adult children who are not caring for their younger children. Um, so this is the stage where we find grandparents having to parent their grandchildren plus take care of their parents. This is a difficult family time, can be. And then family with older adults. These people are adjusting to retirement and aging and possibly adjusting to the loss of a spouse or friends, co-workers. So this can also be a difficult stage. What are risk factors for family development? We have non-modifiable and modifiable ones. Um, You want to find out if families are at risk for health problems. Are there mental health problems that plague a family? Um, and what about maturity factors? So when you're gathering a family assessment, you might have members who are at both ends of the spectrum, both ends of the age continuum as well. Um, what about hereditary factors? So a detailed family history is crucial. If we have um, someone who is genetically predisposed to high blood pressure and aneurysms, then that can affect, especially if they're a family of middle adults, they're caring for parents, but they're also maybe having health issues themselves related to hereditary factors. You know, that can throw a kink into family development stages and tasks. There are also gender or race factors. There are also sociological factors, lifestyle factors such as smoking, nutrition, exercise, stress management, rest, and poverty is a big one that we see, especially when dealing with children. So, whenever we assess these risk factors for a family unit and we start to plan care for these individuals um, and their family unit, we have to be cognizant that our interventions need to be sensitively aimed at addressing the family's specific needs. And if we can do that appropriately, then we can improve their circumstances and we can promote healthy dynamics. So, an example here would be the couple who is having a newborn baby for the first time. Um, Maybe they are very poor. Maybe they do not live in the best area. Maybe they're smokers. Maybe they're both out of work. Um, Maybe they are in an abusive relationship together. Maybe they have no support in the area where they're living, extended family support. So maybe they're alone. Maybe one of them also has a health issue that has caused them not to be able to work. So maybe one's disabled. Um, Roll all of those things into that family unit and your assessment of that family unit, and you can tell right off the bat that they're in a stressful situation already. And being a first time parent and adding a newborn on top of that puts a added stressor onto that family unit. If we can be proactive and we can be sensitive in our interventions at helping them address their specific needs, then we can improve the outcomes for that baby and those parents, right? So that baby would be at a huge risk probably for shaken baby syndrome. And if we can teach that family coping mechanisms related on all of those family assessment factors, risk factors that we gathered, then we might can prevent um, some child abuse or a death related to shaken baby syndrome. Prevention is definitely key in regards to our modifiable risk factors. There are many diseases that are preventable, and the effects of some of those diseases can be minimized. And onsets of diseases can be delayed through lifestyle modifications. So you think about the smoker that we put in touch with the program and help them stop smoking. Effects of diseases that can be minimized. So the person with high blood pressure that we put in touch with the program who helped them stop smoking. And many diseases are preventable. So the smoker that we helped stop smoking and now doesn't have high blood pressure anymore. And also think of abuse in this particular area as well and how we can prevent that in regards to a family unit. Nurses are in a key position in the healthcare setting to be able to assess this, especially when you work in an area like maternal child health, um, labor and delivery, the emergency room. This is an area where you can really get a good idea of how a family unit functions. What about lifespan and cultural considerations? Well, for families entering the childbearing and the child rearing phases, they experience so many changes in their roles and their responsibilities and their expectations. So we move a couple from only having to take care of themselves to having to be there for somebody who's depending on them. So we may have we've got someone who's only had to worry about themselves now having to take care of somebody else. And the somebody else they're taking care of can't do it without them. So that can be very stressful. And older adults seem to feel a lack of purpose sometimes, and they have decreased self-esteem. They're having to depend on their middle-aged children to help take care of them. Financially, they may not be sound. Maybe they lost a lot of money in the stock market and their retirement accounts are drained. So they may have a decreased self-esteem from things like that. And we see all of these things whenever we're in nursing. You have to remember where people are in their family role. So who do we collaborate with as nurses? Well, we collaborate with our clients. We collaborate with interdisciplinary teams to facilitate appropriate referrals, so case managers, home care agencies, Department of Social Services, the WIC department, and we do our best to improve a family's quality of life by intervening based on our assessment of their family unit and what's going on specifically. And we really want to reduce the risk of illness for these people and promote their wellness. So part of our nursing process is caring for the individual as well as the whole family unit. We want to capitalize on the individual and the group's strengths, and we want to minimize risks for alterations in health. So that middle one there is key, capitalizing on individual and group strengths. If we can remember and assess accurately what each member's role is and how they contribute to the dynamics of a family unit as a whole, then we can capitalize on those strengths to help promote wellness and decrease alterations in health for that particular client. So, for example, think about the overweight child that we talked about earlier. If we can assess that family situation, and maybe that family consists of a single mother who works outside the home, whose children stay with a grandmother, and maybe they live with that grandmother. So we have a grandmother, a mother who works outside the home, and an overweight child, and your patient is the overweight child. How can we capitalize on individual and group strengths to best promote wellness and health for that child? So if we know that the mother really is concerned about the weight of the child, and the grandmother is just feeding the child whatever he wants because that makes her feel good, and that is, and in the South, feeding people means you love them. So that's her way of showing him love. Well, if we can educate the grandmother and on some different ways that she can show love, but not through food. So we're going to capitalize on her strength of showing love and making that child feel secure, but just in a different way. And maybe the mom is very good at recognizing what's healthy and what's not healthy. So maybe we allow her to be the one to do the grocery shopping. And then she can grocery shop, and those are the choices that the grandmother has for the kid. So, all kinds of different scenarios that you can consider when talking about family health promotion. So what types of assessment tools do we use when we're talking about these things? There are lots of different assessment tools. Client interviews and observation really are probably key, but there are some specific assessment tools as well, and one of them that your book goes through is a family eco-map. And an eco-map just illustrates families' relationships and interactions with the social network in the community. It allows the nurse to be able to visualize that family's social network. And here is an example of that on that slide that you can study. But what about the family APGAR? Well, this is a really quick assessment tool that's used to initially screen a family. And we do that from these 5 different categories: adaptability, how well can they adapt to their environment; partnership; growth; affection; and resolve. And we can assess those 5 areas, come up with a family APGAR, and it will give us a very quick assessment to be able to screen that family. Another one is called a Home Observation for Measurement of the Environment tool, or a HOME tool. This measures the quality and the quantity of stimulation and support that's available in the home environment. There are different age-specific scales. There are actually 4 of them: from birth to 3 years, from 3 to 6 years, from 6 to 10 years, and from 10 to 15 years. And then there are subscales that are comprised of um, different things that you observe while you're in the home: a parental responsiveness, acceptance of the child, the physical environment, um, learning materials, a variety and experience, and parental involvement. And the goal of this tool is to promote growth and development of the child. So this is actually an observation tool that's done inside the home. And then there's the Friedman Family Assessment Tool, or the FFAM, and this just examines the family in the context of a larger community in which they live. So when we think about nursing diagnoses that we could relate back to family health promotion and wellness, I have here some listed for you that you might see or might be able to consider when doing your concept mapping and your care planning. Readiness for enhanced family processes, readiness for enhanced self-health management, readiness for enhanced family coping, readiness for enhanced parenting and communication, readiness for enhanced immunization status, readiness for enhanced knowledge, and readiness for enhanced decision making. Oh, that's a mouthful. So what about when we start to plan as nurses for these types of clients? Well, we really need to identify potential resources in the community, and your health department, usually in every community, is a wonderful resource for families. Collaborate with the family to select what resources are available to them and which ones are most appropriate for them based on your assessment. We want to involve multidisciplinary teams if we need to. We want children to achieve their developmental milestones. We want them to be successful in school, and we want them to move successfully through their developmental stages. And families play a huge role in helping children move through their developmental stages successfully. We want families to display or describe actions that manage stressors. So, for example, think back to the family that I talked about earlier, the new parents, or the couple who is having a newborn baby and it's their first one, and they are both unemployed and in an abusive relationship. This would be a family that you would really want to be able to get them to manage their stressors, because otherwise their stressors are going to potentially cause harm to that newborn baby. We want to plan for a family system that will meet the needs of their members during developmental transitions. So, thinking back to how your family transitioned as you grew up, successful family systems will be able to meet the needs of their members as they start to change roles and functions within that family unit. And family members will demonstrate actions that improve their overall health and the social competence of the family unit. So our family unit is really it's the basic unit of society. And when you put a bunch of family units together, what do you have? But you have a community. So at the end all, we want family units to be able to successfully contribute to society and the community in which they live. How do we implement all this stuff once we plan it out? Well, we have to establish a therapeutic relationship with that family unit, with the client and then the family that comes along with them. We have to focus on what they're competent at and what their strengths are. We have to provide information that's clear to them on their level. It has to be timely information, and we have to do it in a sensitive manner, because whenever we're talking about interjecting ourselves into the culture of a unit that we're not part of, and we're talking about changing, not even changing, but tweaking the way they view things, and possibly their values in a certain way. We have to be very sensitive about how we go about that. And we want to teach them to identify solutions so that they can problem solve independently. And we want to offer culturally competent care. So we don't want to force a different way of culture onto them, but maybe help them figure out how whatever intervention we are suggesting will fit nicely into their cultural framework. And here is just a little model, a conceptual framework that shows you sort of where family nursing is placed in relation to the society, family, and the individual. And you can see it overlaps all of those three areas. So they intersect with one another, and when you're doing family nursing, you're really taking care of all three of those areas. We want to ask when we start to implement plans based on our nursing assessments for family units, we want to make sure that we're asking questions that direct the family's thinking rather than giving them all the answers, because part of this is teaching that family to problem solve independently. So we don't want to tell them what all the healthy foods are to buy, because that would take forever and you can't go with them to the grocery store shopping every week. So we want we want to help ask questions so that they're able to give us responses as to what would the more healthier choices be for the child who's overweight. We want them to be able to problem solve, and that's one way we can get them to problem solve, is by asking them questions and letting them think through it rather than giving them the answer. Same concept in clinical. Whenever your instructor keeps asking you questions to try to get you to give her the answer, it's because that allows you to be able to problem solve and think independently. So moving through the nursing process to the very end, we're at evaluation, and outcomes are mutually determined, and we base those on the family's progress towards their goals. So we want that family unit to help us determine what the outcomes will be. We don't want to set all those goals ourselves. We want the family unit to help us set goals. We want parents to report an enhanced understanding and achievement of parental tasks. We want family members to demonstrate more frequent engagement in activities that involve the entire family unit. We don't want someone to be left out. And just because we're talking about health promotion and wellness, we want all the family members to have current vaccinations. That is a very important thing whenever we're talking about health promotion and wellness, is to have the family members vaccinated, and that also improves health promotion and wellness for the community and not just the family unit. So when you think of this one, you can think about immigrants. Immigrants who come here and they live in, they live lots and lots of people to a small home. They're coming here from a country that may not have the same standard vaccinations that we do. So you might find that some of them have tuberculosis, or some of them may have chicken pox. And you can imagine how rapidly that would spread through a household living together in close quarters and probably in poverty. And then those children go to school with other children. So making sure family members have vaccinations and that they're current protects not only that family, but that entire society and community in which they live. We want to help them make healthier lifestyle choices. We want them to have the capacity to adapt and function competently after they have some kind of crisis. So we want them to be successful and be able to think independently and problem solve and have the coping mechanisms to still survive as a family unit and be okay even after they have experienced some type of adversity or crisis. So you could think of maybe the death of a child. That would probably be the worst one I could think of that a family unit would have to endure and survive through. When we evaluate, we want to evaluate behaviors as well. So we want to make sure that the behaviors of that unit are demonstrating that they're cohesive, they work together, they have strength together, and that they're emotionally bonded. If they're emotionally bonded to one another, they're more likely to care enough that they'll be successful at the interventions that you're trying to get them to do. There are 4 components of health promotion that you need to know. Those 4 components are self-responsibility, nutritional awareness, stress reduction and management, and physical fitness. And let's go through each of those quickly. So self-responsibility includes a personal choice to be healthy. It's a personal desire and motivation. It's a personal choice of healthy lifestyle, and it's avoiding risky behaviors and unhealthy habits. There are variables that can affect this, and those are genetics, like family incidents, so high blood pressure, diabetes, those kind of things, psychological things like emotional support, and intelligence, like your cognitive thinking or your cognitive development. And then moving on to nutritional awareness. Included under nutritional awareness would be balance of nutritional intake and requirements, reducing sugar, salt, caffeine, cholesterol, food additives, and preservatives. We all know that none of those things are healthy, right? Understanding the relationship of diet and disease. For example, if you have cholesterol, then you want to reduce fats in your food. If you are anemic, you may need to increase your iron intake. The third component, stress reduction and management. This includes things such as the knowledge that stress increases accidents, stress decreases productivity, stress can cause chronic illness. Your family unit or your client needs to be able to identify stressors and how to cope with them. People need to have a strong social support system to help with stress reduction and management, and spirituality can help here. And then moving on to the last one, physical fitness. This just includes the ability to be able to perform your ADLs with energy left over to enjoy leisure time and meet emergency demands. So benefits of being physically fit, we all know that it improves cardiorespiratory function, it improves flexibility, muscle strength, and endurance. It decreases body weight by calorie expenditure and decreases bad cholesterol and increases good cholesterol. And that's not all it does. I mean, it increases, it helps with osteoporosis, it helps with mental health. Um, there's tons of things that physical fitness helps with, and that's a huge part of health promotion and probably one of the most frustrating for nurses because it's very difficult to um, feel successful as a nurse whenever what you're doing is health promotion because you have to depend on people being self-responsible, which is that first of these four components of health promotion. So, probably of all the areas of nursing, health promotion for me is the most frustrating because, unlike, taking care of a high blood pressure where I could give um, a medication and bring it down immediately in the acute care setting, um, when you're talking about health promotion, you're depending on someone else to take your advice and to take your planning and your interventions, and they have to apply that to their lives. It's a very indirect thing, so it can be frustrating. But anyhow, that brings me on to the nurse's role in family health promotion. So, what do we do as nurses in regards to family health promotion? Well, we have to assess the family structure and the function, and we talked about ways to do that. The ECOMAP, the home assessment tool, the APGAR. We have to be an educator and an information provider for individuals and their family unit. We have to role model healthy promoting actions. We have to encourage problem-solving strategies through better family communication channels and the reduction of family stressors. We have to provide culturally sensitive measures to foster family adaptations during crisis. And we have to keep in mind that families do not always function at their highest levels during a crisis. A lot of the times when nurses see clients, they are at a point in life that is a crisis for them, especially if you work in the emergency room. So you have to remember as a nurse, whenever you are trying to assess the family unit regarding this individual that you're caring for, that if it's a crisis that's happening, the family does not really probably function at their highest level during that time. They're utilizing all the coping mechanisms that they've learned. It's a stressful time, and you know that people can act up when they're stressed out. So we have to remember that and just be cognizant of that as we're doing that assessment. All right, so that is the end of individual module 1, family and health, wellness, and illness. And your next lecture will be individual module 2. And thank you for joining.